Okay. And getting back to once the parents are with their child and the child's about to go into OR, okay, and that child has had some preoperative sedation, that has to be the most tense moment, I would think, of the day, knowing that that parent is seeing their loved one be wheeled into OR. At that moment, is that child at ease, or is the child as tense as mom and dad are?
Well, there's lots of ways it's different for every family, but the majority of the times, if the child has received a pre-medication with a Versed, it's a lot like Megan going back to the operating room, the video that we saw. You know, she's very calm. She's sitting on the bed. She's not frightened.
Right. Let's roll that again if we can for new viewers.
Yeah. And then, we introduce the anesthetic agents through a mask. And there's nothing painful about this, and she falls asleep.
She looks very relaxed, and we're going to try to bring that up here in just a second.
But sometimes you can give the pre-medication, and the child may cry when they separate from their parents. But even if they do, one of the great characteristics of the medicine is that it affects your memory. So you have some amnesia, and they oftentimes don't remember that. This is actually beforehand when one of the child life specialists is playing with the patient.
But regardless, this is before surgery, and this child looks very at ease and comfortable with the team. Are the parents comfortable with you guys?
I think, the parents that know us, who work in the hospital, who bring their children in for surgery, are very comfortable with us. If they don't know us and they're meeting us for the first time, we try, like as Dr. Evac said, develop some rapport with them, answer their questions, tell them exactly what's going to happen, what to expect. But it's difficult, and we appreciate how difficult it is for any family to go through this process and have their child have surgery and have unfamiliar faces, taking care of the most precious thing in their life. And we appreciate that. Are you parents? I'm a parent.
Yeah. Ms. Brown from Charlotte, welcome to HealthWise. What's your question?
Hi. I was just very concerned about a child. My child's getting ready to have surgery also. The child's going under anesthesia. Excuse me, I have a cold.
That's okay.
Going under with allergies. How do you handle this whenever a child does have allergies and they're getting ready to have surgery?
Oh, great question. Dr. Hallway, you want to answer that?
The thing that can I just clarify one thing? When you say allergies, do you mean environmental allergies?
Well, like, dust or dog dander or pollen or, the basic kind of allergies.
If a child has there's a couple ways I can answer this. The first is if a child has an acute bronchitis where they're actually sick from a sinus infection because of these environmental allergies, we may postpone the procedure. But those aren't the kinds of allergies that concern us in terms of delivery of care in the operating room. What we are looking for specifically are allergies to medications, because if they've occurred in the past where an individual has had hives as a reaction to a medication, we don't want to reintroduce that medicine to that patient. We don't want to give them another dose of that medicine. We'll use some other medicine.
Oh, okay. I understand.
But it's important to know that, right?
Absolutely.
And that communication with that doctor is very important. That's a great question. Thanks for phoning that in.
Thank you so much.
Isn't this a great show? And a great public service. We appreciate you guys being here and taking the time to explain all of this, because it's not every day that we can talk to an anesthesiologist like yourselves. And I don't know, it just, I would think that you hear this a lot, that is a fear that people have when they've been told they need to have a procedure, that they're going to have to be put to sleep.
That's everyone's greatest fear. They just have an instinctual fear. And at the same time, we do it on a routine basis, try to make it as safe as possible. And we take into consideration all those pieces, their underlying medical condition, the surgical procedure that they're having, how any changes in their normal medical condition affect the surgery and how the anesthesia will impact that. All of that goes into, the anesthetic plan. And I say we are one piece of the entire process. There are many dedicated professionals working in the hospital, as Dr. Evac mentioned, the surgeons, the pediatricians, the nurse anesthetists, the nurses in the operating room, the techs, child life specialists. All of us play a role in terms of taking care of these patients and we're simply one piece, but we're all committed to trying to provide the best care.